Well, the community is still reeling from the tragic events that unfolded during last month's Lapu-Lapu Day Festival. And festival goers and vendors have shared how that atmosphere of joy was abruptly shattered and leaving behind some really deep emotional scars. And joining us today is Rosadene Alcala Apeles, one of the vendors at the festival that day. Rosadene is also a dedicated mental health support worker and harm reduction specialist working in the downtown east side. Rosadene, hello, and thank you for being here.
Thank you for having me.
So this week marked 1 month since the attack. How are you doing?
To be honest, I didn't expect to really be doing as well as I thought I was doing currently. I'm still deathly afraid of, traffic, loud noises. My hands still shake when I'm doing my crafting at home. But I have a lot of support from not only the Filipino community, but also my coworkers. They understand the mental health struggles that happen with trauma like this. Of course, this trauma is on a new level. It's an unseen incident in Vancouver, but people are doing their best to see me where I'm at.
Okay, what can you tell us about that day? You were there as a vendor. How did you get involved?
So I got involved because I was actually at last year's Lapu-Lapu Day event. And for that year of 2024, that was really the Filipino arts community trying to pull everyone together. We understand that the Philippines are made up of thousands of islands, but at the root of everything, we're all a shared experience being Filipinos in the diaspora, whether it be we're first generation or we're fresh immigrants. So last year's Lapu-Lapu Day, of course, was a lot smaller. It was still busy with about 68,000 attendees on a classic pouring, raining Vancouver spring day. But we made a commitment to make the next Lapu-Lapu Day even bigger. And we had Filipinos from Toronto. We had Filipinos from Seattle. We had Filipinos from everywhere coming to visit this year.
Okay, so it all started, the stage is set, everything's going well, it's a lovely day. What do you remember from the day of the events?
So I remember thinking that there was so many more people from so many more backgrounds joining us. We had Hogan's Alley joining us. We had the Souk Meets Mercado section. That was a Palestinian relief. And that's actually where I was set up. I was set up on, not right on the 43rd Street, but I was in the John Oliver tennis court. My vending tent was just on the other side of the fence from 43rd. So the whole day, me and my vendors that were directly on 43rd were just talking through the fence the whole day, waving at each other, checking in if we had water or food, because it was a busy day. It was hard for any of us to leave our tables. But I just remember seeing so many happy communities all sharing this wonderful day of resilience, all supporting each other. There was groups from old people to teenagers to new moms. And, it was just such a trusting environment that I'm still having trouble processing that, that day was such a good day. But I just don't have the mental state to really recognize it as that was a day that was for celebration when it ended the way it did.
Well, and when was your first realization just how dark things had turned? What happened?
So it was towards the end of the day at around 8:06. That time is permanently burned into my memory. But I was thinking of taking down my table because the event technically ended at 8, but the last performance didn't end till just right after 8 on the mixed main stage. So I figured there's going to be a big rush of everyone leaving, and the food truck lineups on 43rd were still pretty busy because end of the day, vendors, their families are coming to visit, they're coming to pick them up. But might as well try and get some dinner before the end of the day, right? So I had my back turned from my table. I was looking down on 43rd. My table was basically situated right where the unprotected barrier was. I remember I was thinking, I'm like, okay, before I take down, let me just check on my other vendors through the fence. Let me see if they have water. They still have lineups. It's still so busy. I might go and get dinner myself, but I'll see if anyone else needs to get anything. So as I turned around, that's when I saw that black SUV. Like, it was coming in pretty hot, and I thought like, oh, this is a school zone. Why is it going so fast? Like, is someone in a rush to leave? Are they trying to load out really fast? And then the car just didn't stop. And once it reached that unprotected barrier, that's when I heard the tires screeching. And before I knew it, the car was just gone. So I was at the first point of contact where the first injury and the first death had occurred.
I'm sorry you had to experience that. Again, 1 month later, I mean, how has all of this had an impact on you personally?
Personally, I think that fundamentally I am a different person than I was at the start of that day. I don't really have as much patience. I used to give a lot of people grace. I used to be able to see people where they're at, but like, I'm taking time off work now because I know that the person I am now is not capable of delivering the care that my clients need. I won't be able to perform at such a level that I can support my coworkers. And I'm really glad that everyone can kind of recognize that. But in terms of like, navigating the medical system, it's kind of been 30 days of phone tag, 30 days of disappointment. But yeah, I have come to terms that this event is going to be part of who I am, whether that be for the better or the worse.
When you say 30 days of phone tag, is that to access services for yourself?
Yeah. So right after, like hours after the event, local organizers from different Filipino political organizations under like the Bayan Canada umbrella, they started coming together right away to post resources, not only in English, but also in Tagalog. And they put together a list of like phone numbers you have to call if you've lost a loved one, like victim services, ICBC. They started like a meal train the day after for people that, of course, couldn't get themselves, put together enough to be able to feed themselves. Like they really help kind of start where you're supposed to look for help. But the event happened on a Saturday night and victim services was closed on Sunday. So, that was like the most painful 24 hours of trying to find out, like, do I have to go back to work on Monday? Do I, like, how am I going to have my rent paid? Do I qualify for like any sort of benefits from this? Because I wasn't personally injured, but at the time, I didn't really recognize psychologically like what that event had done to me.
Understandably, and it's interesting to note that I mentioned your background and your work is in mental health services, in harm reduction, that this kind of thing. How would you say that background informs the kinds of conversations that you've had since the attack?
So that background really opened my eyes at how, like, on a personal level, how inaccessible some emergency resources are. Like, I'm only finding out now after 30 days of the event that I qualify for ICBC provided counseling. Luckily, there was many counselors that reached out to the victims and witnesses personally, but if that community care wasn't there, I would be just sitting on the fresh wounds of what I've experienced for 30 days.
And overall, what's your sense of how much support there is right now for people who have been affected by this attack?
So for right now, the people that are affected, there definitely is adequate care. Filipino BC has done a really good job of, letting the Filipinos and our friends know that there is enough help to go around. We can contact them directly, and that we shouldn't be ashamed to ask for help, no matter how soon or how late you realize that you've been actually affected by this event.
Rosadene, what kinds of conversations would you like to come out of this?
Well, for example, growing up, my father, who is a care aide, and has been a care aide for almost my entire life, he experienced the closing of Riverview Psychiatric Hospital in Coquitlam, where I grew up. And, to this day, I still see his clients on the streets and under my assignments. It has been since 2012 that our mental health policies have been failing these people. And, that rollout of Riverview closing didn't start it didn't start recently. It started around the 60s and 70s. At what point do we recognize that these people that are dealing with our funding, dealing with our policies, at what point do we realize that they have lost the plot? I am a second generation Filipino working in basically decades long of just not only our clients struggling, but also our caretakers struggling.
So you think those conversations are important? Let's recognize that as a society?
Yeah, we need to recognize that every person is a living person with complex experiences. There is no one size fits all policy for everyone. And that everyone will need access to healthcare at one point. Healthcare is one thing we should not be cutting back. That should never be a conversation of trying to penny pinch around healthcare. If we want a healthy society where these tragedies don't happen, we need to acknowledge that we can't sweep these tragedies under the rug. The people that enable this to happen have to apologize. They have to make commitments to do better. That's
a strong message. Listen, Rosadene, we wish you well on your healing journey. And I just want to thank you again. Thanks very much for coming in and sharing that with us today.
Thank you.